Good morning, ladies and gentlemen. It's a great pleasure to see you all here this morning. I have the privilege this morning of presenting my 11th consecutive annual report to the membership of the Institute of Medicine. This means that as of today, I will have presented one more report than the longest-serving president ever to precede me, who was my immediate predecessor, Ken Shine. Now, if you know Ken, who's still working actively at the University of Texas, you'd understand that he certainly would not have left voluntarily if his term had not expired at the end of 10 years. But I do owe a great vote of thanks to Ken for having put into place the conversion of our terms now to 6 years, so I'm in my second 6-year term. And I appreciate the fact that he didn't pull a Putin-esque reverse tumble and find himself back in place already. But I do have a great sense of privilege in doing this, and particularly in being able to report to you on the accomplishments and activities over the past year. The role of the Institute of Medicine primarily is to inform those who make decisions, the deciders, and to spur them to action, to have impact on what happens in policy, in practice, and ultimately on health. And I want today to share with you 3 aspects of our work over the past year, and also looking ahead to what I take to be a really core challenge for us if we want to do even better in the future. So I'm going to spend a little bit of time this morning reviewing some of the new ways in which the Institute of Medicine has tried to reach out, to communicate, to influence, to establish itself in the minds of the public, in the professions, and among policymakers over this past year. I'll then move on to a very brief overview of some highlights taken from among the more than 6 studies and reports that emerged from workshops and from consensus committees over this past year. And finally, I want to share with you a few reflections on the challenge of how do we move forward to boost our impact even more than what we have enjoyed up until this time. So let's turn first to some of the new ways in which the Institute of Medicine reached out over this past year. A really wonderful example of this was the partnership that the IOM undertook with home box office documentaries, HBO documentaries, to produce the documentary series, The Weight of the Nation. This was done in conjunction with a report at the Institute of Medicine on accelerating progress in obesity prevention. And it enlisted, in partnership, other federal agencies at the NIH and at the FDA and at the CDC particularly, and also reached out widely amongst the academic community to get more people involved. This series, which first was broadcast in the spring, was nominated for an Emmy Award. We had an opportunity to walk down the red carpet in Los Angeles. We didn't come home with an Emmy, but we came home with a lot of great visual memories and some rather amazing experiences at the celebration in the evening, as I guess only Los Angeles can manage. This year we also undertook a program to extend the reach of our work on epilepsy, a very important study on epilepsy that came out earlier this year with several dozen sponsors actually interested in this study. And we had a 5-point quiz that was adopted by more than 20 of the sponsors and used to amplify the availability and interest in understanding of this disease. And if you haven't actually taken the quiz, it's a lot of fun. Search for it on our website and see how well you do on the 5-question quiz. We really jumped into the infographics world this year. Again, based on our work on accelerating progress in obesity prevention, we produced an infographic, only a small portion of which I show on this slide. An infographic is a graphical display that conveys in visual images and content the essential meanings and content of a document or report in our case. And in this instance, the infographic conveys very succinctly the 5 essential areas that our committee, in its report on accelerating progress, identified. The area of physical activity, where the notion is to integrate physical activity into your daily life. The area of food and beverages, to make them more healthy in terms of options. The importance of marketing what is good for our health as well as what we might otherwise want. The centrality of working through the workplace as well as through our healthcare providers. And finally, the importance of strengthening schools as the heart of health, especially, of course, for our children. This particular infographic has been ordered, although it's free online. We sell hard copies. More than 8,000 copies have been ordered, and it's been also translated into Spanish at the request and generosity of the California Endowment in order to make it even more widely available in the population. Another very important study and infographic related to the report that I'll say more about a little bit later on best care at lower cost. This infographic that conveys, again, the key ideas of this report accounted, when it first came out, for 5% of the total traffic to our website that particular day. So it was an extremely popular release, and it also was picked up by the Washington Post blog and also at National Public Radio blog in order to amplify the attention and understanding of a very important set of messages. We've also enhanced our core graphic distribution by translating a number of our key report graphics, especially those directed at the public at large. Here, our report on weight gain during pregnancy, specifically on this project to help ensure that Mexican-American women who are particularly prone to have excessive weight gain during pregnancy would know more about what they needed to do to ensure more likely a healthy baby. This particular project was actually supported by our Kellogg Health of the Public Fund, which many of you contributed to at the time we were putting into place this endowment, which enables us to reach out in these fresh and important ways. Another great example of the Kellogg Fund's outreach is a program that we have inaugurated called the Smart Bites program. It actually began as a pilot several years ago. Initially, it was launched in Bowling Green, Kentucky. The basic idea of Smart Bites is that youngsters can get a card that will enable them, when they're out buying food, to get discounts on healthier choices. And it seemed to have worked very well in Bowling Green, and we're now going to be expanding it to other communities in Maryland and elsewhere. We've engaged an external evaluation group to try to help us understand how well this works and what more we can do to push the ideas in our core reports out into the community. A really exciting project from this past year on the integration of primary care and public health was amplified significantly by the development of a video that, if you haven't seen, I again urge you to just log onto the website and take a look for a few minutes at this video. It's all about asthma. And it takes asthma as an example of the ways in which community-based programs, coupled with primary care commitments, can dramatically change the prospects of asthma in communities and in patients around the country. It's a very exciting extension of the kind of reporting that we are traditionally accustomed to doing. And we also had this year an unusual venture still going on an interactive report model. The basic idea of this study, which is a study on ranking vaccines, is not simply to put in place a single report that tells you as of this moment in time what should be your priorities for new vaccine development, but instead to develop a tool, computer-based, that would enable decision makers over time to refresh and renew as new knowledge, new diseases, and new capacities in science emerge, to regularly refresh the assessment of what it is that would make sense now for attention to priority setting in vaccines. And this study is now entering a phase 2. We will see how well we can do in actually distilling the essence of the ideas in the first report, which was a blueprint, into code that can actually be used by decision makers. I also want to mention some of the new forums and roundtables that have started. I was pleased to see that as of now, the Institute of Medicine operates 15 forums and roundtables. These are groups that bring together industry, academia, government, the public, the professions, to focus on a subject of shared interest. About half of these started just in the last 5 years. 2 of them started in the last year, and one, which had a meeting that I am depicting here on this slide, is directly connected to the subject of our conference this year, of our annual meeting. This is the new IOM Global Forum on Innovation in Health Professional Education. And at the meeting that was held, here we're seeing a report from Dr. Maricha de Villiers from South Africa, because this group also has already inaugurated a number of action collaboratives based in different parts of the world, the 4 being in Canada, India, South Africa, and Uganda, selected for the purposes of helping to disseminate pilot programs and new ventures that would put into practice the principles of new professional education, such as we developed in our report on the future of nursing, and that emerged from the Lancet Commission on the future of the health workforce, something that we're going to hear more about, I'm sure, in our major address, keynote, just a little bit later this morning. I also want to mention another new opportunity for communication that we have put into place. These are what we call perspectives. Many of them are, in fact, attached to our forums, but a perspective is a individually or collectively authored, but named authored pieces. They're not reports of the IOM, but they are hosted and disseminated through the IOM. They're of 2 types, somewhat longer discussion papers that we call discussion papers, and rather brief, focal, more op-ed style pieces that we call commentaries. Here's an example on the left of the CEO checklist for high-value healthcare, sponsored by our roundtable on value and science-driven healthcare. And this set of 11 CEOs put together their key ideas on what they do to promote value in their institutions. And this was picked up in many quarters. The American College of Physician Executives, for example, endorsed and disseminated this particular discussion paper very widely. The other example here is just a commentary on personalized medicine by Senator Frist. Interestingly, just this month, if you subscribe to Consumers Reports, the new November issue has just come out and available in our homes. In this particular issue, the president of Consumers Reports, Jim Guest, who is a participant in that roundtable, also participated in the development of a discussion paper on communicating with patients about healthcare evidence. And this was based also on a survey that Consumer Reports undertook in conjunction with the colleagues on the roundtable. And in his president's column, in that issue, Jim Guest refers to the poll at the Institute of Medicine and encourages all the readers, the thousands of subscribers, to look for more at iom.edu/evidence. So a very exciting, another extension of the way in which perspectives can reach out. So we've had a lot of innovation and new work this year on communicating more effectively. Let me just touch upon very briefly some of the core reports that have set the standard this year and been the basis of so much of this effort to communicate more widely. I want to begin just with a few of the reports that grew directly out of the issues on health reform. Here we had a report that was a follow-on, a second report on geographic adjustment in Medicare payments. The first report laid out the principles. This report looked specifically at the potential effects on implications for access, quality, and efficiency. There was also a very important study that lays out the criteria and standards for determining essential health benefits. Essential health benefits are defined in part in the law, but not completely. And our committee took the legal requirements and went beyond to say what would be needed in order to balance the desired coverage and costs in order to enable most people to get what is truly necessary through their health insurance, a very important contribution. Also this year in healthcare, a really significant report that I alluded to already on best care at lower cost. This report tries to define the standards and tools that will be necessary to achieve the goal of high quality, available care at a reasonable cost. And it points to the fact that in the United States, we waste hundreds of billions, estimated at $750 billion a year, in expenditures that do not contribute to the improvement of health. And this set of opportunities is a very important, critical need for our nation. The committee goes on to outline the core tools that are available now to improve on what we have done. It makes 10 specific recommendations talking about what is needed. I believe over time, this report will take its place in the foundational reports that have truly reshaped thinking about healthcare as a result of initiatives emerging from the Institute of Medicine, going back a decade and more to the core reports on safety and quality, and now the report on a learning healthcare system pointing to the way we can achieve greater value in the future, something that I believe will have resonance for many years to come. We also did a number of really critical studies on the scientific enterprise, on the conduct of research, on the standards for research, on ways to improve research. One really significant study on chimpanzees and biomedical and behavioral research pointed to the advances in science that no longer necessitate as much reliance on chimpanzees as an experimental animal. And the committee laid out very clear criteria to direct judgments and decision-making about when chimpanzees would be needed in studies. This report was immediately adopted, and the criteria were applied at the NIH, and it now currently shapes the way in which our nation makes decisions about the use of chimpanzees in biomedical research. The other report that I just want to mention and highlight at the outset on the evolution of translational omics is essentially a report that looks at cases of errors in the way we have adopted and used omics-based research for clinical care. And the committee draws lessons from all of these experiences to outline best practices that would enhance the development, evaluation, and translation of omics-based tests and ensure that these tests are appropriately assessed before they are applied in clinical trials. And it's a very important landmark study that will have much increased influence as more and more of the genomics-based information is available to be translated into clinical practices. Beyond the Accelerating Progress report, I just want to mention briefly a report on the front of package nutrition rating systems and symbols. Have you ever looked at what they actually put on the front of the packages and made sense of it? Our committee said it's too complicated, it's too varied, it doesn't convey instantly and clearly to the public what you need to know about what's in this product. The committee said, look, tell us the calories, and then just develop a simple point system that will deal with saturated and trans fats, sodium content, and added sugars. That's it. Put that on the front. Let people make their judgments. Now, it hasn't swept the whole field yet. But interestingly, when Walmart this past February came forward and announced their own Great For You front of package labeling, Andrea Thomas, who's the vice president at Walmart, said that they made sure that this effort was aligned with the Institute of Medicine's front of package committee report. And so it has influenced one of the major purveyors already and undoubtedly deserves much wider adoption. We did a number of important studies that dealt specifically this year with regulatory strategy and guidelines, building on a long tradition. One of the ones that I think was especially important was the report that dealt with how do we ensure safe foods and medical products in today's globalized market. You may not appreciate that 40% of the fruits and nuts that we consume in the United States come from outside the United States. It's estimated that 85% of the seafood originates outside the United States. And when it comes to pharmaceuticals, 80% of the ingredients that are used even in domestically produced pharmaceuticals are imported, and 40% of the finished products come into the country from outside. So if we're going to ensure safety of food and pharmaceuticals, we cannot begin and end at our own borders. And the committee laid out a number of steps, 13 steps that should be taken to help ensure the necessary multi-sectoral involvement and international collaboration that could, over time, enhance and ensure the safety of our food and our drugs. A number of studies this year elevated to visibility and focus important issues around critical diseases. Epilepsy, I've already alluded to. For such a visible problem, it's remarkably unseen in the United States. In the area of breast cancer and the environment, the committee outlined a research agenda that would be needed over time to help define more clearly and completely the origins of breast cancer. In the case of Alzheimer's, our committee laid forward a set of guidelines for diagnosis that I believe will be very important clinically going forward. In the domain of population health, a number of critical studies. I alluded already to the primary care and public health study and the asthma video. I might just also mention for the public's health is really the third in a trio of studies that began in 2009 that looked at for the public's health from the vantage point of data and measurement, and then from law and policy, and now on the needs to invest in a healthier future. And here, among the very important ideas that the committee set forth were the notion that communities should identify how well they're doing against a set of minimum standards for public health services. And the committee lays out that minimum package. And they urge the development of a chart of accounts, a kind of accounting principles, but would be applied to the performance of public health agencies. And they also point out the necessity to invest in public health if we're to achieve our goals. I want to mention also a number of studies that dealt particularly with our veterans' health in this past year. We had studies on post-traumatic stress disorder, on substance use disorders in the military, on the issues of traumatic brain injury. Do you know that it's estimated that 13 to 20% of all veterans returning from the Iraqi and Afghani war theaters experience post-traumatic stress disorder? Millions of people around the world are experiencing traumatic brain injury, and the numbers in our veteran population has tripled over the past decades. Substance use disorders is a pervasive and profound problem in our military, as in fact it is in the larger population, but in the military, the number of prescriptions for painkillers has quadrupled since the year 2000. So there is a problem both of prescription and non-prescription substance abuse in the military, and our committee points to the ways in which we can face up to it and do something about it. In the area of disaster and emergency preparedness, there were a very important series of workshops that pointed out a number of critical issues and ways to help our nation's first responders and preparers to be better able to respond and to anticipate what will be needed. Amongst the interesting and important contributions this year was our report on crisis standards of care that tried to emphasize what has to be done in order to provide effective, high-quality care under conditions of crisis management. And it set forward specific recommendations for hospitals, for out-of-hospital providers, for state and local responders, for emergency medical services, a report that will undoubtedly have tremendous value increasingly over time. Now, all of these ideas, all of this enormous work, and there are thousands of expert hours of work invested in these studies, would come to no useful end if we did not have a way to increase the impact of what we do. We've tried in a number of ways this year, as I pointed out, 10 different innovative ways of communicating. The question is, what more can and should we be doing? We know it's going to take a lot to reach the highest levels of our own thermometer measuring our degrees of impact, which starts at the bottom with spreading the message and extends up at the top to affecting change and improving health outcomes. And we do try to track and monitor how we do on this degrees of impact. But we know we have to do more. We know we're going to need bright ideas, more fresh thinking. We know we're going to need more collaboration with outside partners to extend the kind of reach we had with HBO, so that we can even be more effective in reaching the public and reaching policymakers. And we know we're going to need to put resources into place to do this. Too often, many of our government sponsors particularly think reasonably that the product is the final report. For us, though, the product is not the written report, it's the change in the world that we want to make. And we have to find a way to put in place the capacity to effect this. And it's not going to be easy to move dramatically, not simply incrementally, but dramatically forward. I want to just share with you in the final couple of minutes a couple of insights from two visionaries that I think help set the parameters for why this is so difficult. Daniel Kahneman is, I'm sure, well known to many of you, Nobel Prize-winning psychologist, the only psychologist, to my knowledge, to win a Nobel Prize in economics for his work with Amos Tversky on prospect theory. Kahneman wrote a wonderful book last year called Thinking Fast and Slow, his effort to translate for the lay public decades of work on how people actually make decisions. And this draws upon extensive studies that he and others did about the way people really decide. And it points to a number of heuristics or shortcuts and anchoring principles that distort from logic what our decisions really are. Anchoring, if you ever wonder why even a modest-priced restaurant will have a $300 bottle of wine listed, it's not because they expect anyone to order the $300 bottle. It's because if you see $300 on the wine list, you're going to be more likely to order the $60 bottle than the $30 bottle. You've just been anchored. So Kahneman explains all of these phenomena, which are so powerful and pervasive. When he came on Friday to the National Academies Keck Futures Initiative Communications Awards ceremony, because his book, Thinking Fast and Slow, was the book award winner for communication to the public in science this year. He made a very telling observation. He said, when it comes to the way people use evidence and decide, most of us have it backwards. Most of us think that people take the evidence and then draw their conclusions and come to their beliefs. In fact, he said, much more often, it is people's beliefs that dictate what evidence they perceive and experience. Now, the other person up here is Tony Schwartz. He may not be as well known to you. Tony Schwartz was a genius in the use of media, in my estimation. He was an archivist of sounds. His collection of thousands of sounds is now in the Library of Congress. He worked out of New York. In the 1960s, he produced the ad that drove tobacco ads off of television. If you'll remember, some of you at that time, the ruling of the FTC was that the tobacco companies could continue to advertise, but that the stations had to have equal time for anti-tobacco advertising. So Tony produced an ad which had two children in front of a big mirror, dressed up with their parents' clothes and trying on the jewelry and stepping into the high heels. And that was most of the ad, until the very end, when a voiceover said, "Children love to imitate their parents. Children learn by imitating their parents. Do you smoke cigarettes?" That was the ad. And that was enough to convince the tobacco companies that they didn't want to mess with Tony Schwartz. He was the producer of what many consider the most powerful political ad ever produced, and that was the 1964 Goldwater-Johnson campaign. And he produced an ad in which there's a young girl with a daisy plucking petals, counting up, not very well, 1, 2, 6, 3, until she gets to about 8. And then the camera pans into her pupil, and a male voiceover starts counting down from 10. And when it reaches 0, a nuclear explosion occurs. And then the screen says, "Vote for Lyndon Johnson." They never mention his opponent. That ad appeared once, and if you saw it, you'll never forget it. Now, Tony wrote a number of books. His first book was called The Responsive Chord, and he made a very powerful point in this book. He said, in advertising, you cannot push something into anyone's head. Your job is to elicit from them what is already there. Now, if you combine Kahneman's message about beliefs and Schwartz's message about advertising, I think we have an enormous challenge. Because we start from the premise that our job is to take the best of science and to make it available in the hope that it will change beliefs, which Kahneman says may not work, and that it will enter the minds and change the thinking of people that Schwartz says is the wrong way around. So I think we have a fundamental challenge. We have to adopt a kind of pincers movement on this task of effecting change in the minds, hearts, and actions of the public, the professions, and policymakers. Yes, we do need to make our science more suited and better communicated to effect change, to make it relevant, to make it timely, to make it salient to the decisions. But we also need to understand better the processes of thinking, decision-making, and change that truly determine what people believe and do. So my challenge to us over this next year is to take up both of those critical tasks. We're going to try to put more money in place with the help of our council to enhance the impact. But I think we need to do more than just incrementally move forward. We need to think and devise a strategy that is fundamentally innovative in the way in which we, as scientists, as experts, can help the public, the professions, and the policymakers make decisions that are more consistent with the evidence. Thank you all very much.